Alright, y'all, let's start toxicological emergencies. This is a big gigantic chapter. It's got 177 slides.
It's going to be a 3-dayer
Yes. Alright, Trish and Brian just obtained the chief complaint and some preliminary information from the mother's 2-year-old boy named John. John was found with an open container of lamp oil, and because he had the substance around his mouth, brothers believe he may have drunk some of it. Drunk or drank? I feel like it should be drank too. I mean, I've been out of school for a long time, but I just feel like that should be drank. Yeah, me too. Somebody asked me to write a letter of recommendation the other day, and I was like, I really don't remember how to write in a complete sentence. John is awake alert, and he seems a little scared at the commotions going on in his house. What additional questions could they ask Johnny Boy's mama?
How long ago did he not have
Yeah, that's good. That's good. I'm down with that. How long have you not been watching your kid? What information do they need about the products that may be involved? List of ingredients. What? Who do we call? Poison control. See what the number is? Just for future reference. I don't even know my own phone number. It's 1-800-222-1222.
It's too many twos.
That figures.
I mean, that's too many twos.
Are the exception. Brandon, that is your homework. You must come up with a
Jingle.
poison control jingle. Just because you annoy me.
Oh, okay.
What?
That cracked out me.
Exactly. We will record it, put it on YouTube, and you'll be famous. You'll be viral. No, I'll be viral. I'll tag you. Don't worry. Keep on. Y'all gonna be in the accompaniment. That would be good. What resources will help in assisting the EMTs with treatment and transport and decisions? Poison control, fantastic. I'm really scared.
What do y'all recommend? I won't be around. I got one.
No, it's got to be no credit. Alright, poison can be accidental or intentional. Many calls for poison control centers involve children, and there are special problems associated with drug and alcohol emergencies. Alright, so what exactly is a poison? A poison is any substance that impairs health or causes death by its chemicals. Most poisons are accidental and involve young kids. Other causes of poisoning include suicide and homicide. Toxicology is actually the study of toxins and its antidotes. Overdose of drug or medication is a type of poisoning. Alright, you can get poisons into your body by 4 routes. You can ingest them, you can inhale them, you can inject them, and you can absorb them. This is also the same routes that may cause an allergic reaction. You go back and look
Jesus. Like Kool-Aid. It can't taste that
at
good.
that's what I'm thinking.
Right? Like, there's no way a kid's just going,
Like, I could understand them eating a whole bottle of Flintstone vitamins. Like, I can understand, because I love Flintstone vitamins. Right? I think that's called FICA. Like, they have like a mineral deficiency. ingestion. This little child here is ingesting a drug or substance.
She's right.
It's Kool-Aid, Mommy. It tastes good. This is the most common route of poisoning. I hate all y'all. Inhalation, breathing, a poison, typically a gas, vapor, fume, or aerosol. Hits the lungs, enables rapid absorption into the body. The poison is transported down the respiratory tract with each inhalation until it reaches the alveoli. When in the alveoli, the poison can cross the alveolar capillary membrane and it enters the bloodstream, where it's then transported throughout the entire body. No. Injection. A poison can be injected under the skin, into the muscle, or directly into a blood vessel. This can result in a local reaction to the poison, which is usually immediate. A local reaction typically causes edema at the site of injection, redness, irritation, and sometimes pain. Systemic reaction can occur from injection of poisoning where it gets distributed throughout the body. Absorption. A poisonous substance can enter the body when it comes into contact with the skin or the mucous membrane. The signs and symptoms of poisoning in patients depend on the specific poisoning and the route of entry into the body. One poison might depress the central nervous system, leading to bradycardia, slow, shallow respirations, and hypotension, whereas another one might stimulate the central nervous system and cause tachycardia, tachypnea, and hypertension. The route of entry can determine how quickly the patient presents with these expected signs and symptoms. Alright, most care for poisoning patients is supported. Okay, you want to maintain patent airway. Keep a careful eye on their breathing, oxygenation, circulation, monitor their mental status, be prepared for vomiting. And you want to reassess these people very, very frequently. An antidote is a substance that neutralizes the effects of the poison or toxic substance. Many people think that antidotes are available for most poisons. However, true antidotes are only available for a small number of poisons. The treatment of poisons is generally limits or prevents the absorption of the poison and then manages any other signs and symptoms that can occur. Emptying of the stomach and absorption from the small intestine varies. Okay? Always remember or always determine when the substance was ingested. Alright? Was it 5 minutes ago? Was it 2 hours ago? Was it 2 days ago? Okay? Alright, poisonous substances commonly used. Over-the-counter medicines, illegal drugs, household products, and cleaning agents. I mean, it smells good, but it's just like licking a pine tree, and I just don't think that I want to go out and lick a pine tree.
It's shot that floor so good that the shot there inside.
This is clean out.
Okay.
It's
Alright, moving on. The ingestion of poisonous plants is a common poisoning emergency, especially in children under the age of 5. Yep. Poisonous plants are not necessarily exotic. Nope. They include common household plants and backyard plants, such as morning glory, rhubarb leaves, buttercups, and daisies. Is that like a Reese's buttercup?
No.
Seriously. Daisies, daffodils, lily in the valley, tulips, azaleas, English ivy, mistletoe berries.
Yeah, it's nice.
Yes.
It's not big.
You know what else is poisonous? Were those red and white things that you get at Christmas?
Poinsettias.
Poinsettias.
That's what I was about to tell you.
Yes,
They're-
they're poisonous.
Like, yeah, kids are bad about apparently. It's like, apparently they taste good.
Apparently, animal milk.
Dogs.
Yep. Well, I don't have it. A high number of poisonings result from eating wild mushrooms. Story about a wild mushroom. what if he tasted the pizza? He kept sharing it, and I'm like,
It's like,
yeah, 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 like, exactly. I didn't think to ask if it was like Johnny's or.
no, man.
I didn't know a whole lot about Louisiana back then.
Too cheap. I had Little Caesars.
$5. I agree. Holy crap, I hate oil. Alright, poison is the number one cause of accidental death among kids. So, well, yeah.
They make them play out of your kids. Like,
That's why I had time I can get it. Package you want to freaking clothes. I don't know. Yeah, I don't know. They used to love cinnamon. They used to eat cinnamon. I don't want to say that either. Alright, primary assessment says for mental status. It says airway. Anticipate vomiting. They will vomit. Intervene as needed. Provide positive pressure ventilation if their breathing is not adequate. Maintain oxygenation at SpO2 of or thank you. Alright, Chad. Assess their circulation, their secondary history. Consider that multiple substances may be involved. You want to consider the trustworthiness of the history from the patient who's overdosed. You need to ask them, what exactly did you ingest? Was alcohol involved? Did you also ingest that? When or how long ago did you ingest that substance? Over what time period did the ingestion occur? Like, did you sit on the back porch at 6 o'clock in the morning, topless, smoking cigarettes, drinking a quart of Pine-Sol, or, you know, this the normal thing that you do? Now, how much of this stuff is
Jesus Christ.
I can't do anything, y'all. Has anyone attempted any kind of treatment? This is usually involves milk, okay? I don't know why. People think,
It's supposed to make it winding around.
yeah, don't do that. Do you have a psychiatric history? 'Cause that would be the only way I would understand you doing consult. Are there any underlying illnesses? How much does the patient weigh? What medicines are available at the scene? Holy crap. And focus on the patient's complaint. Reassess. Alright. Signs and symptoms. History of ingestion. Swelling of mucous membranes of the mouth. Nausea, vomiting, diarrhea, altered mental status. So many things I want to say. Alright. This is burns around the mouth. So what would be the immediate concern for this patient? Okay, it's on his face. So, activated charcoal is medication that is What is the role of activated charcoal in treating patients with ingested poisoning? What exactly does it do?
It's all stuck together and lets it pass through
So
the
that you
system.
don't absorb it, right? Fantastic. May not have your drug card, but you've been studying.
Oh, yes, I have been studying.
That's what it was supposed to be.
Do what? No. What is that?
1 kilogram of body.
1 gram or 1 kilogram of body weight. 50 grams in that tube.
Make that another position.
Yeah, I guess.
30 milligrams.
So, emergency care, maintain the airway, protect from aspiration, assist inadequate ventilation, maintain oxygenation, prevent any kind of further injury, transport the patient immediately. Consult medical direction or poison control, activated charcoal may be ordered. Bring the substance with you to the hospital and reassess frequently. Many poisoning from inhalation occurs as a result of a fire. These poisons are rapidly absorbed into the body. The longer the patient is exposed, the substance will work for prognosis. So, some of the common things that you're going to see that will be inhaled: ammonia, chlorine gas, sulfur dioxide, industrial gases, carbon monoxide, and carbon dioxide. Chemicals, sprays, solvents used in dry cleaning, greasing agents, and fire extinguishers. Some poisons are inhaled intentionally to get high. Patients who inhale paint and propellants are commonly referred to as huffers. Huffers are discussed later in this chapter. The toxins are inhaled in a variety of ways to produce sudden expected effects. These substances can have many effects as they displace the oxygen content in the alveoli and lead to hypoxia. Some of the common things that people huff is paint, freon, gas propellant, glue, Brandon, nitrous oxide, you have a little exposure to that, do you? Do you have a problem? Do you need some help? I'm here for you.
Trying to get a job in this office. Never know that.
Probably wouldn't put that on my resume.
Right before you go to hell, just,
Yeah.
hey, let's do this.
Alright, you're seeing size up. You need to be aware of your own safety. Note any kind of odors or fumes. Some inhaled poisons are colorless and odorless. Look for placards. There's vehicles involved. If hazardous materials are involved, request resources. Do not enter the scene unless it is safe. You can determine the number of patients. Assess and closely monitor the airway. Breathing. Assist in adequate breathing with positive pressure ventilation. For adequate breathing, apply oxygen, non-breathing mask, and circulation. You want to consider trauma, their history. Do a physical. Ask the patient, do they have a history to suggest a suicide attempt? Did the exposure occur in an open or confined space? How long were they exposed? Alright? You need to protect yourself. Okay? First and foremost. First rule of EMS, protect yourself. Support any loss of function during the primary assessment. This goes for anything. So, signs and symptoms. History of toxic inhalation, difficulty breathing, chest pain, tightness, burning in the chest or throat, cough, dry or wheeze, crackle, hoarseness. Confusion, altered mental status, oral or pharyngeal burns. Okay, anytime you go to a house fire, any kind of fire, you need, and a patient is being exposed to that fire, you need to have them open their mouth, you need to look in the back of their throat, you need to look up their nose to see if they have any singed nasal hair. Okay? If they have singed nasal hair, singed facial hair, if they have little black particles in the back of their throat, they have a toxic exposure. Okay? They can have copious amounts of secretion go into said burning building to pull you out. So, place the patient in a position of comfort, ensure that the airway is open and maintained. Administer oxygen by non-breathing mask for active breathing regardless of their SpO2. Use positive pressure ventilation for inadequate breathing. Bring all information available about the substance to the receiving facility and reassess the patient frequently. Alright, injected poisons. These poisons enter through the body through a break in the skin. Include intentional injections of drugs and animal or insect bites or stings. The effects can be local or systemic. Anaphylaxis can occur in response to some of these. Alright, you're seeing sawdust. You need to look for drug paraphernalia, indications of bites or stings. Primary assessment, correct airway, breathing, circulation, low on oxygen. Your secondary assessment, history, physical, any signs and symptoms, and reassess. Alright? So, you need to ask them, is there a history of drug use? Is there a time lapse between exposure and the onset of signs or symptoms? What type of animal or insect bite or stung the patient? Bit or stung the patient? Alright, this is a rattlesnake bite. So, said snake is still there. Scene is not safe. Even the snake is dead. Dead snake, bad snake. No bad. Be like a bird in fire somewhere. So we Alright, during the secondary assessment, get a history from the patient or bystanders and as much information as you can about any substance that might have been injected or about the kind of insect or animal that might have inflicted a bite or sting. Used to, they used to tell us to put dead snake in a truck with us and take it to the hospital. That will not happen in my truck. If you want to put it in your truck, by all means. But however, it will not go in my truck.
Also, just do.
Hey, this was before the
Oh, I
whole
know.
cell phone craze. But, however, I will say this, all anti-venom, doesn't really matter what you're bit with, all anti-venom is used to treat, it's called, Crobab. It's called Crobab, it's about $1,500 a vial, the rest of it take 8 vials. Yeah, very expensive. Most of the hospitals around here, like Carroll, carry 4 vials. That's it. Transfer you somewhere else.
Just give them the first one, later now.
Yep. That's another facility. Yep. Unless it is a coral snake. I don't even know if we have coral snake here. I think we do.
Their venom's different.
Their venom is different than a pit viper.
We have another guy.
I really don't know about that.
It's hard to get. Because
Back there, so.
you are on the state. So, find one, give it to me.
Just like
You know the how to tell if it's actual
yeah.
red on yellow, yellow bella, red on black, venom white,
Yeah.
or red on
There's a few different versions, but I've never
Jack,
seen red on yellow.
None of them, my friend. So
When I was living in Peru, like I would stay out in the mountains many days with them. They would tell us about different scorpions and different snakes you can see up there. If you see a brown scorpion, those will kill you, but we have antivenom for that. We had this one lady, she woke up, she fall on her chest, and she was still. Oh, that happens all the time. There's all those things. If you see a black scorpion, though, we don't have the antidote for that. No one around here does. Several days from the nearest town. So
Yep. No.
Here.
No.
I feel like they're small little kitty bits. Not
Like
big.
it's nine.
No. It's natural. It's natural scorpion. But they sting you. You got like a pattern of meat. It's a pattern you
Oh. That's good. All right. Whew. During the secondary assessment, get a history from the patient, provide standards, as much information as you can about any substance that might have been injected or about the kind of insect or animal that might have been on the patient. You will see anywhere from they will be sedated, you have higher and low blood pressure, pupillary changes, track marks, patient's injection site, trouble breathing, abnormal skin binding, could be hot, sweaty, stuff like that, depending on what takes up. Possible paralysis, swelling, or redness. Protect yourself, maintain an airway, be alert to vomiting. Use positive pressure ventilation if you need to. Bring all available information about the substance possible with you, transport rapidly, and reassess. Absorb poison, air through the skin or mucous membrane can cause skin and mucous membrane irritation or burns. Risk of exposure increases daily. Poison can cause both local skin reactions and systemic reactions. Alright, so, signals up, note the container or plants in the environment, wear gloves and other protective gear if needed, call for additional resources as needed, remove the patient from said area. Want to note containers or plants in the environment, wear gloves. I've already said this already. Assess mental status. Assess airway, breathing. Inspect for any poison remaining on the patient or their clothing. Don't want to put that in the drug vision. Get a history and do a real good physical assessment and reassess. Alright. Signs and symptoms. Do they have a history of exposure? Do they have traces of liquids or powder on the skin? The skin will have burns, itching, irritation, redness, or swelling. More like your farm-based chemicals, stuff like that. They will have signs and symptoms of contact with poisonous plants. Feel like you're poison ivy, poison oak. Some people can look at it, talk about it, and they will break out. Some people can roll around naked in it and not have the first problem.
Me too.
So, it all depends. They'll have fluid-filled oozing blisters, swelling, pain, rash, itching, and burning. These people will usually be covered with head-to-toe calamine lotion. Alright, wearing gloves. Remove the source of the poison and the patient's contaminated clothing. Somebody also told me that if you burn poison oak, poison
That's what I
ivy,
was
it
saying.
can get in the air.
Yeah, you burn it. As soon as you inhale it, it doesn't matter if you're allergic or not, you will immediately start feeling it. And what happens is it'll start popping up on your lips, and then it gets down to your throat. If it gets down to your lungs, that part where you start coughing, you gotta go to the hospital. Because the fluid will build up in your lungs. It's not fun. I've watched it a few times, but that's just did it. Burning the leaves. I had a pile just for poison ivy right here. Cut out tree brush. Pile of just poison ivy. What does the idiot do? Takes a rake, breaks into the burn pile, and I hear him start going, and coughing, spitting up, and throwing up, and it's like, oh no, I feel it. Look over the pile, you can see all the vines over it. I was whoever's in that vicinity, so I'm sitting there walking. I'm sitting there with a mask on.
It's a good time to wear my mask.
Yeah.
Does that protect? Does the mask protect against
It
poison
will.
ivy inhalation, or is that like a?
It becomes too saturated.
Does it have to be an N95 or just a regular face mask?
You put her down to it. Wet, damn it. It's like, especially
Wet,
like
didn't it?
for smoke inhalation, but damn it. Probably just see face.
Stamp and regular food.
No, it's fine. Use positive pressure ventilation. runs away from the unaffected eye. We don't want two eyes infected or affected. Taking care not to spread the contamination. Alright, Trisha and Brian began by removing John's clothes and having his mother help rinsing him in the bathtub to remove any residue. As they do so, they examine him and monitor him for problems with his airway and breathing. The EMTs have decided to contact the Poison Control Center, which will come in soon. As soon as they have collected additional information, they will include the guidance from Poison Control Center in their radio report to medical direction. John's mom had left him alone for just long enough to put a load of clothes from the washing machine into the dryer. When she returned, she found John with an open bottle of lamp oil. She estimated that the event occurred about 15 minutes ago. The 16-ounce bottle was full and now appears to have about an ounce gone. It appears that most of the oil is on John's clothing. She is uncertain whether he ingested any of it or not. John's mother confirms that John has not vomited, but he did have a period of coughing before the ambulance arrived. John's airway is open, his breathing is normal, clear, and equal breath sound. He is active, denies pain in his mouth, throat, or abdomen. Because of the uncertainty of ingestion, the history of coughing, and the potential seriousness of hydrocarbon exposure, poison control, recommends transportation. The EMTs make sure John is warm, and they use his safety seat for transport. The ER physician thanks the EMTs and limites them. That ain't never gonna happen. Telling them that John will be observed for several hours for indications of aspiration and ingestion of hydrocarbons. It's usually, why'd you bring them here? Why'd you bring them here? Alright. Case study number 2. Warren is traveling on business, staying in a hotel when he starts to feel ill. He becomes nauseated. Followed shortly by the onset of vomiting and diarrhea. He has severe abdominal cramping and is beginning to feel like he's got a fever. I don't know what he thinks. Maybe he didn't get that buffet last night. Wasn't such the best idea. How is food poisoning similar to other types of poisonings?
That's the Stevens AKC.
Okay, thank you, Sue. Yeah. What are the particular concerns with this type of poisoning? What other signs and symptoms might you expect to see? Okay, sweating,
I had some real bad last year. I ate some mushrooms that were just past the expiration date. And
That
no, I didn't get them out of the cow pasture off the cow. They weren't cotton food. But yeah, for like 3
were they
days.
like slimy and stuff? You still cook them?
A little bit. I thought it was like just past the expiration date that I could cook them and it would just kill whatever was in there.
Slimy
No.
mushrooms are no-no.
But yes, I know that now. I don't even eat them anymore. No, not what I just said. It was slightly moist, slimy in the beginnings of slime.
No, sir. You rinse them and wipe them off.
I didn't do that.
I didn't just like-
Well, no, freaking wonder. You need some cooking lessons, sir.
Oh, that was the school of hard knocks.
I bet it was.
It's terrible.
Yeah.
Dehydration is definitely
Yeah.
coming out of both ends. Sometimes. I
It's
literally
wearing mine, won't you know? Don't they, Micah?
I couldn't even
Just make sure I
stand
wasn't
up.
the only person in this room that had that.
Alrighty then.
Oh.
Well, illness can result from bacteria in food or from the toxins released by the bacteria. Food poisoning is increasing in incidence. Common source is seafood. Lots of living. Food products most commonly associated with poisoning emergency: eggs, chicken, ready-to-eat foods, cheese, processed meat, untreated water, unpasteurized milk, fish, salmonella from contaminated food and water or from undercooked food, Campylobacter bacteria, food poisoning from unhygienic food preparation associated with foods served cold, such as desserts, custards, and/or salads. Yeah, yeah. I cannot. Not do like that slimy stuff. Just no. I want you to think about it. Holy crap. No, no, no. No.
I don't like
No, no.
No, it'd be like, if that's good, that's good.
What did you eat?
Like lettuce, big one.
You can't, you brush your
Yeah,
teeth.
you have to use your water bottle.
Well, yeah.
Stop bottle.
Yeah. I'm always taking bottled water.
Nothing wrong like a mission store.
Yeah.
And
I've been back here several
this dude, right there is, this dude, he drinks, right? But then, like 5
It
hours.
makes you like,
That's
That's
it.
No, we were there building orphanage. So like, we're helping build.
you can still drink alcohol, right?
This dude was literally sitting there dying. You know. Just bring a little bit of alcohol.
I have any lettuce there though. Marina's on the street corner. Freaking amazing, I'm telling you. They sell cheap beer too. And their beer over there has a higher alcohol content than the beer over here. Learn that the hard way. Yes, I did. Yeah, that wasn't a problem. I was tired of it. Yeah. Note that their beer has way more alcoholic volume.
Now they're tequila.
Yes, yes, they are.
They're tequila.
Look, you're off a cruise ship, and them suckers are standing there with shot glasses. Olay! Olay! And I'm like, yeah, Olay! Yeah. I'm telling you.
Exactly. They come out with
Yeah, it's a picture. Yes, yes. I love Mexico. One of these days, I'm gonna be rich and retired in Mexico.
Hey,
Yes.
hey, we pay 20 for like a game.
50 pesos.
No, they don't want pesos. They want
They want American money.
Oh.
money.
They want American money.
But
Yeah, you don't have to do any money walking over there.
they don't want no, you can't. It's one beer, right? $1 each. So every beer that you get, a shot of tequila. So we're sitting there. And it was like he was just my cousin and my buddies walked off. We're sitting there, you know.
That's right.
Yeah, they walked off and got like followed these two Mexican strippers.
Oh, you're talking about Mexican strippers.
No, they followed them to get leave, right?
Okay.
They followed just two like Mexican going up each They followed these dudes right behind a construction site. We see driving everywhere, the big old trucks are running. Something got paid or something right there. But no, like I said, over there doesn't smoke. He's busy.
Y'all in Yucatan, espresso. They have $3
That's what we were.
We had,
But in however, lesson learned that day was not about beer. Lesson learned that day, Lord said, oh, because Pittsburgh, Jesus, I did not watch it all.
just leave it on enough.
Yep. Yep.
Now, were you drinking beer and eating while you were getting the massage? Or?
A little bit before, beer during, and lots of beer after. Probably why I did not know that I was colored. Yes. Yes. I was past lobster stage. Yeah. You can actually get sick.
It's fun. Yes.
All right, time to send it to Big Boy 3, a loud and frequent vowel sounds. Well, that's nice to know. I appreciate that. And I can kick that off my to-do list today. Micah's vowel sounds. Alright, follow your general guidelines for ingested poisoning. Establish and maintain an open airway. Oh, crap. I'm going to have nightmares. Positive pressure ventilation for inadequate breathing.